Hello, my name is Nyla Caesar, and this is my internship reflection. So, I was an intern at Our Lady of the Lake, and I had two different departments. My first department was patient care services, and the second was employee health. In patient care services, my supervisor was Miss Aisha, and she was over seven departments at Our Lady of the Lake. She was more involved in the business matters and not necessarily the medical aspect, so she wasn't necessarily a nurse or anything. To the left, you can see the lady, I call her Miss Kayla. That was really a real person. Her name was Miss Kayla. She was a charge nurse in one of Miss Aisha's units, and her unit ended up being my home unit, which was STU, which stands for Surgical Trauma Unit. And then on the far right, you can see Mr. John Doe. I didn't shadow doctors, but I did shadow many nurses, CNAs, and CSRs. My units and assignments in patient care services. So, Miss Aisha was over many different units, as I previously stated, which included neurology, surgical trauma unit, and Med 1, Med 2, etc. Due to this, her interns were allowed to go to different units each day, and we were also assigned to shadow different positions each time. So, during my time there, I shadowed a CSR, which was basically the unit's receptionist. CSRs do a lot with inpatient and communicating to different units about patients and their different needs, talking to families, much more. I also shadowed CNAs who were nursing assistants, and they did many things like clean up patients. They could help pass medicine, take vitals, etc. And I shadowed nurses, which did all of that plus more. During the second half of my internship, I was assigned to STU as my home unit. So I reported there each time I went to patient care services, and I really learned a lot. And I was able to eventually run the front desk with little to no assistance. In patient care services, I was able to make and deliver ice bags, take vitals. I didn't take them, but I watched and I learned how to take them and what the difference was between patients and what numbers were good for some and bad for others. I also learned how to answer patient and family member calls and their questions whenever they came to the front desk, and what to do for them if they needed certain things. And I also learned how to page CNAs and nurses using Volt, which is basically a computer system. And I was able to participate in minor housekeeping, like making beds and things like that. I also learned how to do discharges when working with a CSR or a CNA, more than likely a CNA, but sometimes if they were short-staffed, CSRs could complete discharges. And it wasn't very difficult at all. You had to ensure that the patient made their appointments for their aftercare, that they picked up their medications, that they spoke with everyone on their medical team, and then you cleared the patient's room and emptied their chart, and you escorted them downstairs to their ride. In employee health, Miss Stacy was my supervisor, and she absolutely loves us. She was a wonderful supervisor. She's a nurse. I believe she's an RN. And so she was able to see patients, give flu shots, TB tests, assist new hires, and she can administer drug tests. That's Miss Stacy to the far right. To the left of her, that woman represents Miss Diane and Miss Wanda, the other two nurses on the floor in employee health, and they are also nurses and they do the same things as Miss Stacy. And to the far left, the man, he represents Mr. Reginald Jr. He goes by Reggie, but as a joke that we have, he doesn't want us to call him Reginald Jr., but it's a respect thing, so we always called him that. But he was a very nice coworker. He worked in kinesics and he conducted range of motions, and so he would only see new hires during their appointments. When we worked in employee health, I say we because there were 2 other interns there with me, and we all worked together to complete these tasks. But so we had a lot of patients that came for the flu shots because it was mandatory for them to get it by a certain date. So it's very common that they came in and they had to complete their surveys, and we helped them set up that. And they also came in for returning to work, and they had to be cleared by employee health, or they were a new hire and had to have an assessment. So we would check them in and get their paperwork ready to go and report it to their nurse. We also learn how to prep needles, and so this diagram shows you a bit of how it would look in real life, but you screwed the base to the top, and you had to make sure it was completely sterile. And once you had the hang of it, it was pretty easy. 5 things that I've learned are how to prep needles. I learned many medical terms, including NPO. I also learned that many patients may be in the same units, but they're there for different reasons. An example of this is med surge and also like surge 1, surge 2, even stew. There were a lot of patients there, but they all had different things that were wrong with them. I learned how to make a hospital bed, and I learned that there are different diets for different patients. NPO is a diet for a patient, which means that they can't have any food or any liquids past a certain time. This was definitely career altering for me, this internship experience. Um, I realized that as much as I was interested in medical aspects of many things, there were a lot of things that I realized that I don't really want to do or engage in. So I decided to go into the dermatology field where I only see skin. And also, dermatology is still very interesting, and there are a lot of aspects to it, but it's not very, it's more clean to me. I don't know. My overall thoughts and takeaways. Overall, I'm very grateful for this internship experience. The information I've learned will follow me through the rest of my career and my life. Not only did I learn medical information, I also learned that many people come from different backgrounds and not everyone can be treated the same way. I learned that many people may be difficult, but everyone deserves patience and positivity because most people are in pain and just need help. Overall, I'm very, very, very grateful for this internship experience, and I learned even more than I mentioned in this paragraph. But this internship really changed the course of my life and how it would go. And I didn't think that it would have as much as an impact as it did on me, but I'm very grateful for the information that I learned and the people that I've met during my internship. And I hope that I'm able to stay in contact with them and eventually learn more from them.